Good evening, everyone. Am I audible?
Good evening, sir.
Very good evening. Ready, everyone?
Yes, sir.
Very good. So now I am giving you few images, and you have to tell me that how we can do the treatment planning. आपको बताना है, right? But before that, just to discuss few things. थोड़ा सा कुछ चीजें डिस्कस की जाए. First, I am muting all of you. Then after, in the last, I will give you chance to unmute. So look at few things here. Few energies are excessive energies and we need to sedate. And few energies are deficient energy and we need to tonify. कुछ ऊर्जाएं अधिक होती हैं तो सेडेट करना होता है और कुछ ऊर्जाएं कम होती हैं तो टॉनिफाई करना होता है. फॉर एग्जांपल स्ट्रेन. ओ आई गॉट स्ट्रेन, आई गॉट एंकल स्ट्रेन, राइट. खिंच गया, कुछ तन गया, खिंच गया. I was running and suddenly got the strain. It's the excessive energies and I need to sedate it. मुझे sedate करना होगा. On the other side, tiredness. So I am very, very tired. I was working throughout the day in my office. Now I got tired. So these are deficient energies and need to be tonified. ये कमजोर ऊर्जा है और इसको टॉनिफाई करना होगा. Right? Hyper functioning of any organ like hypertension. Hyper. Wherever hyper is written. That is excessive energy like hyperthyroidism, hyperparathyroidism. Hyper means too much. That is excessive energies need to sedate. And hypofunctioning of any organ like hypothyroidism. जब भी कोई hypofunctioning हो जाती है, hypo का मतलब है कम. The meaning of hypo lesser. So we need to tonify. Now coming here. Psychic excitement. Person is very much excited. Then we need to sedate. Or nervousness. Oh, I am feeling very nervous. I am having my exam. Oh, I am feeling very nervous. Or irritation. They are excessive energies and need to be sedated. इन्हें sedate करना होगा. On the other side, oh, I am feeling very drowsy or depressed. Drowsy or depressed is the sign of poor energies. Maybe we have to tonify. Anger and joy are the excessive energies. When we are having good energy, excessive energy, we are angry or joyful also, the excessive energies. गुस्से में होना या फिर प्रसन्न होना, ये दोनों अधिक ऊर्जा के कारण होता है. On the other side, anxiety is due to the poor energies, sadness due to the poor energies, and the fear due to the poor energies. That's why if you are in the fear, you will be just sitting down and don't want to do anything. And you're in the sadness, you just is sitting down or lying down. और जब व्यक्ति गुस्से में आता है तो तोड़ता है, फोड़ता है, मारता है. We can see the excessive energy expression during the anger. The joyful person also having good energies can perform many tasks. But when we talk about the sadness, it is a sign of fear, it's a sign of poor energies. Now, fast breathing, someone breathing very, very fast. Sometimes we know how many times we breathe in a minute. हम एक मिनट में कितनी बार सांस लेते हैं? Normally we breathe 15 to 20 times. हम 15 से 20 बार सांस लेते हैं 1 minute. But sometimes breathing too fast. Maybe you are running. While running, we are breathing fast. So the fast breathing is a sign of excessive energies. And the slow breathing is the sign of poor energies, deficient energy. We need to tonify. The red phase means high heat. The red phase is due to the excessive energies. And the pale phase is because of the poor energies. Pale means poor hemoglobin, poor blood, poor thing, something is poor. The person is having loud voice. अगर किसी व्यक्ति की आवाज दूसरे कमरे से भी यहां तक आ रही है, the person is speaking in the other room and the sound is coming till here. This is the sign of excessive energies, right? So, and the person is having very poor voice. Even the person sitting next not able to hear. That is a sign of poor energy. These are the very wonderful diagnostic tool. एक व्यक्ति बहुत साउट करके आवाज कर रहा है, तो उसके अंदर कुछ ना कुछ एक्सेसिव ऊर्जा है जो उसे बॉदर करेगी. The person is having excessive energies. We need to calm down. For example, if the person is doing some addiction, taking alcohol, or I was treating one patient taking opium, अफीम लेता था. When I was talking to him, the sound was too strong, too good, like even he can speak from the distance and we can hear very properly. Then I found sound is good, sound is very loud. So there are greater chances that he might suffer with excessive chi. And then he told that he is not able to sleep. Then we sedated chi, then we calmed down the chi and then sleep. Then he was able to sleep afterward. So the loud sound or the very, very poor sound. Poor sound is the sign of poor energies. A strong pulse, we are checking the pulse. Pulse is jumping too much. Tap, 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 too much pulse. This is a sign of excessive energy and sometimes even very difficult to feel. We are not able to feel the pulse. That is a sign of weak energies. कभी कभी हमें pulse मिलती नहीं है. That is weak. The constipation is most of the time is because of the excessive energies, constipation. And the diarrhea because of the poor energies. So in the constipation, most of the time, we are sedating. I'm telling most of the time, so not all the time. In the old person, constipation might be because of the lung weakness or the heart weakness. बुढ़ापे में constipation lung या heart की कमजोरी से भी हो सकता है. Because when you are pushing the stool downward, you are using the power of your heart. आप जब स्टूल को नीचे पुश करते हैं, you are pushing the stool downward by using the power of your heart. That's why the person suffering with the heart problem in the old days, they are suffering with the constipation also. And many person also getting heart attack on the stool pot. कई लोगों को हार्ट अटैक भी आते हुए दिखा है, वो बाथरूम में जाते हैं एंड वही उन्हें हार्ट अटैक आ जाता है while pushing the stool down. Heart play very important role. Even the pregnant lady pushing the fetus downward during the delivery, she using power of diaphragm and heart. Do you know that? Are you aware with that? कि जब प्रेग्नेंट लेडी एक बच्चे को डिलीवर करती है तो अपने हार्ट की और डायफ्राम की ताकत यूज करती है. सो शी इज यूजिंग द पावर ऑफ हार्ट एंड डायफ्राम टू पुश द fetus downward. That was she's sweating a lot. She use lots of effort. Heart play very important role, right? So urinary retention. Now look at here. There are two conditions. यहाँ पर दो condition. The condition number one, urinary retention, and the condition number two, urinary incontinence. देखो पहला है भरा रहना. Retention means something is there, he is not going out. Oh, urine is not passing. Oh, urine is not passing since 2 days. That is excessive energies. Something got stuck, not want to come out. Urinary retention. आपने सुना होगा किडनी वन लगाओ तो यूरिन बाहर निकल आता है. Pushing the kidney one part. So many persons suffering with the urinary retention. Sometimes urinary retention might be because of the urinary stone or maybe some other problem. This is excessive chi. And urinary incontinence. Oh, not able to hold. यार पेशाब को होल्ड नहीं कर पाते. As soon as the thoughts of urine is coming, oh, I have to run, I have to rush. That is called urinary incontinence. That is the deficient energies. Is it clear to everyone? So whenever you are planning the treatment, okay, you are suffering with the urinary problem, okay. What the, oh, I can't control, I can't hold. मुझे होल्ड नहीं होता. Deficient energies. Not coming out. That is excessive. So these points are very much important and we are using them for diagnosis. So like hypothyroidism, we are tonifying the thyroid is working less. Thyroid का काम क्या है? T3, T4 secretion. This is the work of thyroid. T3, T4. T3 and T4 are the very important hormone are needed for metabolism. जिनकी जरूरत हमें मेटाबॉलिज्म के लिए पड़ती है. और the T3, T4 are keeping your body warm. अब मुझे थोड़ा T3, T4 कम लग रहा था ये पे. अब ठीक है, ये T3, T4 हो गया. External T3, T4. Got it? So now if I don't have jacket, then I will do the tonification of thyroid. Then I will tell the thyroid, please make more T3, T4, because T3, T4 will increase the temperature. That's why in the winter season, thyroid is working very nicely. We are having good hunger. We are having good heat in the winter season because of thyroid gland. Now, what is hypothyroid? Hypothyroid means now thyroid is working less, so we need to tonify. On the other side, what is hyperthyroid? We know that hyper means working more, so we need to sedate it. हमें इसको sedate करना होगा. Anything which is hyper, we need to sedate it. Right? In this way, we have to plan the treatment for any disease. Okay. Now, look at this image. Now it is clear. Yesterday we have seen bind means liver and gallbladder. Heat means heart and small intestine. Hotness means pericardium and triple varma. Humidity means stomach and spleen. Dryness means lungs and large intestine. And coldness means kidney and UV. So when I'm telling coldness meridian, consider kidney or UV, anyone in this way. Okay, let's come to this image. Now I want to do the treatment of head region. Now I want to do the multiple division of the head region. अब मुझे हेड के मल्टीपल डिवीजन कर देना है. So number one person is suffering with some problem in the head region. एक व्यक्ति को हेड रीजन में कुछ प्रॉब्लम है, राइट? Let's take the acute problem and use the yang chen. So once a person is suffering with a headache all around the head, front, back, right, left, everywhere. So the one person is suffering with a headache, right? All around the head, everywhere. What is the treatment? Make the treatment in your notes. Remember one thing, the nature of headache, this is the, we can tell, dull headache. Dull headache. Make the protocol. Those who know, they make the protocol. I'm giving you 2 minutes. 2 मिनट का समय दे रहा हूं, फिर मैं डिस्कस करूं. Dull headache in the head region. जिसका हो गया वो ग्रुप में डाल दीजिए फोटो क्लिक करके. जिसका नहीं हुआ वो करते रहिए. आराम से करिए, कोई जल्दबाजी. We should do right. Whether we should do slow or late, there is no problem. Yes, humidity is plus plus. Yes, choose the hotness meridian, perfect, yang hotness. Okay, चलिए अब हम इसका डिस्कशन करते हैं. आपने, the person who has done mental exercise, they will understand more. Let's see. So I told you There is a dull headache. What is dull headache? Dull headache means humidity. हम डल हेडेक का मतलब समझ चुके हैं पहले. The meaning of dull pain or dull headache is humidity, and the opposite energy is the wind. So humidity sedation and wind tonification. We are using axis rule. अभी हम axis rule समझ रहे हैं. Once the axis rule is becoming clear, then we will go to the some other rules also. So the simple treatment: humidity sedation and wind tonification. And humidity is the main thing which we are doing. So we can sedate the humidity with the opposite color, which is the green color. तो हम ह्यूमिडिटी को ग्रीन कलर से सेडेट कर सकते हैं, बिकॉज ग्रीन कलर इज द कलर ऑफ ग्रैंड मदर. And we tonify the between the same color, so we'll put the green color here also. Right? Let's see the treatment now. अब हम treatment plan करें. So we are going to the hotness meridian. Where is the hotness meridian? अब हम hotness meridian पर जाएंगे. So this is the hotness meridian, central one. The central one is the hotness meridian, right? The name of this meridian is triple warmer meridian. What is the treatment? Sedate humidity. Humidity को sedate करना है. So we have to sedate this. We are putting the green color. Tonify wind, we are putting the green color. Sedate humidity, tonify wind. If I want to use the magnets, I will put the yellow magnet here. And I will put the white magnet here. अगर मुझे magnet करना है, so I'm sedating with the magnet here. Yellow magnet and the white magnet for tonification. Then we will put the magnet in the controller also. So controller only here with the controller humidity selection. Simple. So please don't mix magnet and color together. Right now, yellow is not the color. Right now, yellow is the magnet. White is the magnet. Are you not mixing the color with the magnet now? Both are separate. Because we not putting yellow color. We are putting magnet, which look like yellow from the top, that is sedation. Is it clear to everyone? हर किसी को समझ में आ गई बात? अब हम जाएंगे. Now we'll do the further classification. अब और दिमाग लगाना पड़ेगा. अब हम एक स्टेप छलांग मारेंगे. So look at this image. So now we have divided the head in the multiple parts. अब हमने head को ही multiple part में divide. The central part is coldness. We can see this line is going from the outer side of the eyes. This entire area is coldness. This left is wind. We can see the wind. Eye to ear, that is wind area. आंखों से लेके कान तक का एरिया wind है. Then on the back side we can see heat. Exactly on the back central, that is hotness. then humidity on the right side, then again dryness on the front side and coldness. Now, one person is suffering. एक व्यक्ति को दर्द हो रहा है. इस पार्ट में पूरे में हो रहा है. चलो, dull pain in this part. The one person is suffering with the dull pain in this part. Eyes, nose, everywhere here. What is the treatment? अब हम कैसे ट्रीटमेंट प्लान करें? Now see here. Now we have to follow two-step treatment. अब हमें two-step treatment follow करना होगा. The step number 1, head is the hotness. The step number 2, the central area is the coolness. So we have to follow two steps. अब हमें दो स्टेप फॉलो करना है. स्टेप नंबर 1 and step number 2. Step number 1 is head is hotness. Step number 2, front central area is coldness. Right? So we have to, first we will put the hotness point, then we'll reach on the head, then we'll put coldness point, then we'll be reaching to this area. Because now we don't want to treat entire head, we just want to treat this area. So let's plan the treatment. So first step, choose the hotness. पहला स्टेप है कि आप हॉटनेस को चूज करें. The step number 2, choose the coldness. The second step, coldness को choose करें. Then you do the treatment, dull pain. So let's do the treatment. चलिए अब हम ट्रीटमेंट प्लान करें. So look at here. Okay. Step number 1, choosing the hotness. So we have chosen the triple warmer or the hotness. हमारा पहला स्टेप है कि हमें हॉटनेस को चूज करना है, तो हमने ट्रिपल वार्मर को चुन लिया है. Got it? The step number 2, in the hotness we have to put the point of coldness. अब इसमें भी हमें coldness का point लगाना है. Where is the point of coldness? Can you see? Can you see the point of coldness? This upper point. This upper point is the point of coldness. This point. Look at all the points. This upper point is the point of coldness. So we'll put the coldness point. अब हम coldness point लगा देंगे. Suppose I am putting the needle. I will put the perpendicular needle on the coldness. This is my needle. I have put the perpendicular needle on the coldness point. But how can I give the treatment on a single point? Because as soon as I put the coldness point, then I am reaching to this front central area. लेकिन अब मैं सिंगल पॉइंट में ट्रीटमेंट कैसे दूं, क्योंकि ये तो सिंगल पॉइंट है. It is not possible to give the treatment in the single point. So coldness meridian will be available. As soon as we put the point here, the coldness meridian will open. Now coldness meridian, we are going to give the entire treatment in the coldness meridian. I will repeat once again. मैं एक बार repeat. Head is the hotness. So we are choosing the hotness. This central triple bow meridian means we have reached to the hotness. But we want to choose the central area, so we are choosing the coldness. So this is the uppermost point is the coldness point. We can see it's written coldness. See. So we are putting the needle on the coldness perpendicular needle. When we are putting perpendicular needle, it's called renting. Neither we are doing tonification or sedation. We are putting the perpendicular needle, or we are putting the green color. Suppose we are putting the green color. Green color is the color of renting. As soon as you put the coldness point, we will reach into the front central area. Now coldness meridian will open. Now means front central part will open. Now we do the treatment. What is the treatment? Dull pain. So dull pain, what is the treatment of dull pain? Sedation of humidity, tonification of bed. So now we are going on this urinary bladder meridian, which is the coldness meridian, which is our selection meridian. We will sedate the humidity. अब हम humidity को sedate करेंगे. We already know humidity can be sedated with the green color and will tonify the bend. Bend can be tonified with the green treatment. So this is the treatment. But whatever our main action, अब हमारा main action क्या है? Tell me, what is our main action? Humidity sedation is the main action. Whatever our main action, that will go in the controller. जो भी हमारा मुख्य एक्शन होता है वो कंट्रोलर में चला जाता है. That go in the controller. Got it? So triple warmer and this governing vessel are the controller meridian. This triple warmer meridian and the governing vessel are the controller meridian. So well, there also we can sedate the humidity. So we are sedating the humidity with a green color. And here also we are sedating the humidity with a green color. Treatment is over everywhere, green, green, green. Okay, now, what I have done exactly here. First, I have chosen the hotness meridian. In the hotness meridian, I have chosen the coldness point, or I can put the perpendicular needle. This is my perpendicular needle on the coldness point. Now coldness meridian will open. अब मैं क्या करूंगा? Now I will sedate the humidity. So we know this is the humidity point and the direction of needle like downward, because the humidity, we can see the energy is moving upward like this. In the yang meridian, energy entering from the arm and exiting from the leg. So I'm putting the needle in the opposite direction of the humidity. On the bend point, I will be putting the needle on the same direction. और bend में हम needle को उसी दिशा में लगा देंगे. Same direction. Done. We can do with the needle. And what is our main action? Main action is sedation of the humidity. So we'll sedate the humidity in the triple one. Now first see the direction of energies and see the humidity point. So sedate the humidity, put the needle in the opposite direction. You can see the direction. Now humidity also will be sedated in the governing vessel. So taking the needle and we are Sedating the humidity in the thumb also. Done. समझ में आता है कि आपको उंगलियों में समझाया जाए. किसी किसी को ऐसा भी होता है कि फिगर में समझ में नहीं आता, तो फिर उसे उंगलियों में समझा. Anyone is there like that? Not able to correlate what is happening exactly. वाह, कुछ लोग तो बहुत अच्छी इमेज भेजते हैं. वाह. ये सरिता देवी जी बताइए.
म्यूट.
हाँ बोलिए.
सर जब हम लोग ड्यूअल मैग्नेट यूज करते हैं तो रेंटिंग के लिए कौन सा कलर यूज करेंगे सर? उसमें तो टोन और सेपरेट सिर्फ होता है ना
स्टार मैग्नेट यूज कर.
रेंटिंग में? ठीक है, ओके सर.
फिर कई लोगों का एक प्रश्न होता है, एक काउंटर क्वेश्चन होता है. देयर इज अ काउंटर क्वेश्चन. Actually, there are three types of the magnets. One is the like Biot magnet doing tonification and sedation, right? But star magnet, if you see the pole of the star magnet, if you check the star magnet, then it exactly like the sedation magnet. Sedation magnet कैसा होता है? We are putting the magnet from the top. What is the color looking like? Yellow. Am I right? If we put the magnet,
Right.
it's looking like yellow. Even I checked the star magnet. When we are putting, it's exactly because when multiple magnet we are putting together, right? So they are coming together. Then we can see star magnet also. When we see as per the pole wise, it's look like that it's doing sedation, right? Because try to understand the concept.
ठीक है सर.
Suppose, but star magnet is having multiple, like have you seen multiple stars, multiple ridges? Ridges देखिए उसमें स्टार मैग्नेट में. The star magnet having multiple ridges, so it's dispersing the energies. It's changing the energy pattern, right? So that's why we have another very good option also, methi seeds, fenugreek seeds for sedation. Yeah, methi के दाने भी sedate कर. Yes. Got it? Clear? Okay. कितने लोगों को समझ में आए? How methi? नहीं, methi seeds doing renting, not sedating. Sorry, methi seed doing renting because methi is not having any pore. Yes, please, Riyazji. Yes. What doubt you have? You can ask.
Sir, I have a small doubt because when we are rendering, we are using green color for the previous experiment we were discussing. And after the treatment, for the controller and the super controller, we are using the same green color for sedation. Now, is it that will be, misguided to the another meridian like spleen if you put on the humidity meridian, the green color? If you are pushing needle, we have a direction. But about the green color, we have a issue on that one. That's why.
Actually, even you are thinking in a very right way. Sometimes even I think that green color we should not put for renting. I'm thinking the white color is the good color for rent. White. Why?
Maybe. Yeah.
Because white color is the combination of all the color, right?
Okay. Then yeah, this is the
Because
complete.
white color is the combination of all the colors, all the 7 colors. Even sometimes I'm thinking the white color is the best color to be put for renting purpose, because when we talk about the color therapy, white color we are not using for any purpose, right?
Yeah.
Suppose now you can ask, but white is the color of metal. White is the color of metal.
True.
Everyone knows कि white color है metal. But white is the color of metal. But you know, brown is also color of metal. You know that? Brown and white.
Yes, sir.
For the color therapy, we always use brown color for metal. We never use white color for color therapy. White color just we are using for diagnostic purpose. Oh, some white scaling metal. Okay, so there's a difference. So even what I think, even I was thinking today itself that we should use, instead of green, better to go some other color, because green color is the yang color in the nature. Yang color, wind, then the heat and the hotness. So white color can be used as per my personal understanding. When we talk about the tri-origin, in the tri-origin, there is a different theory. Hetero, homo, and neutral. That time green color is the color of neutral. Okay, good. But this 6K is not the tri-origin. 6K is the coming from the tri-origin concept, but 6K is the different. So what I think, white color might be good, but the problem is this: whether we put the green color or the white color, we are getting the results. I've tried both.
Okay, that's one.
At both, we are getting the result from both. I thought maybe let's use white color for this person for renting. I got the results. Maybe green color used for this person for the renting. Aren't they getting? So the problem is this: if suppose I'm not getting the result in here for this patient, then I might think, oh, white color is the confirmed color for the renting. But you also think green color sometimes might not be good color as a renting purpose, because green color is the color of wind energy, right?
True.
So if anyone is thinking in that way, you're not thinking wrong. You're thinking right. And you are having full freedom to think. Because this Sujok concept is not a fixed concept. Everything is changing as per the energies, right? Clear, Riyazi?
Okay, thank you very much, sir.
Okay.
It's only for the color combination, this controller and supercontroller, I got this doubt. The other one is we have a direction, you know.
Yeah.
Okay, thank you. Thank you.
Do you know that when we mix all the color, which color is coming out?
White.
White color,
Yeah,
right?
true.
So white color is the wonderful color for renting. You can use it.
Thank you very much.
You can try it. Okay.
Sure. Thank you.
So then many of my friends, I discuss with them, okay, I am trying white color for renting. Please, you also try. So they told me, I am just trying. I'm not using color for renting. I'm just keeping my finger and thought, rent, then moving it. That is also working. That is also working. So now this is the out of questions. Means even not using the color for renting also working. Just thoughts. Keep the points. Rent, jump. तो मैं फिर से रिपीट करता हूँ कि कई लोग तो रेंटिंग के लिए कलर ही यूज नहीं करते, मैग्नेट भी यूज नहीं करते, रेंटिंग वाले पॉइंट पे उंगली रखते हैं और उसको बोलते हैं रेंट, डन, और आगे बढ़ते हैं. In this way, they are also getting results. That's why these concepts, if you see, these concepts are called the consciousness concepts, like our consciousness working. Okay. So now, so in this way, this treatment is very wonderful. Okay. So now I am proceeding ahead, but before proceeding, I would like to giving you homework here. Here, if the person is suffering with a pain in this area, that is acute pain in this wind area, the person is suffering with a pain in the area between eyes to ear, that is the acute pain, what will be the treatment? This is the question number 1 for your homework. Right. Acute pain. Question number 2. Person is suffering, here is the bone that is called mastoid process of the temporal bone. Person is having the pain in this mastered process of the temporal bone in this entire area, and that pain is very, very severe, unbearable pain. What is the treatment? Right now. Next question. Person is having swelling in this area. Swelling means humidity plus plus, remember. Initially, I am taking only few concepts so that you understood. Then I will take too many concepts, not only pain, swelling, redness, inflammation. There are lots of things we'll be discussing. Right now, I'm okay. Tell me swelling in this area, in this hotness area, what will be the treatment? उसका treatment क्या होगा? Question number next. The person is suffering. Like we can see the bind on one side. यहाँ पर जैसे बिंड एक तरफ है. If we go to the other side, अगर हम दूसरी तरफ चले जाएं, इस तरह. So on the one side we are having bind. On the other side we'll be having humidity. दूसरी साइड तो ह्यूमिडिटी होगी ना. Look at here. So from the top of the head till the here, this is the area of the humidity. This is the area of the humidity. So bind heat, hotness is the back area. Now I'm talking about this area. The right side mastered process pain here in this area. So one person is suffering with a problem in this area. On the back side of the ear on the right side, redness and inflammation. The person is having redness and inflammation in this area. Redness and inflammation is the heat. What is the treatment? उसका ट्रीटमेंट क्या हो? Now the question number last. One person is having pain in this area, means the right side of the cheeks, that's the dryness area. This pain is the nerve pain or neuralgia. So remember here, nerve pain or neuralgia is the person is suffering with the pain in the dryness, that is the nerve pain or the neuralgia. So nerve pain, definitely all the pains are generally we are considering in the humidity, dryness and coldness, but when the neuralgia, nerve pain like the trigeminal neuralgia. The trigeminal neuralgia because of the inflammation in the nerve. It is due to the inflammation. So we are keeping it under the heat. Not all the pain we are keeping in the heat, but it's due to the inflammation. So one person is having excessive heat in this dryness area, so suffering with the inflammation of the nerve and having pain of the trigeminal neuralgia in this area, what will be the treatment? So we have to study the heat. आपको हीट को सेट करना, इतने आपको होमवर्क करना है. कर पाएंगे? Will you able to do this? If you have any doubt for doing this homework, you can ask in the group. so that we will clear your doubt, because we want that you should do the homework. Got it? So now tomorrow we don't know class will be there or not. I will put in the group, because tomorrow we are starting class for Chinese participants and few Indian participants on the TCM tongue diagnosis. Definitely class will be in the morning, Saturday, Sunday morning, then Monday, Tuesday, Wednesday in the evening. So definitely Monday, Tuesday, Wednesday, our class will not be there. But tomorrow I will put in the group. If I don't have any of my schedule, then I would like to take your class tomorrow. Okay. I will put in the group before 3 o'clock. Okay. So you should complete your homework. Yeah, so left side mastered is the heat area, and right side just opposite to heat. What is opposite to heat? Dryness. If there is the coldness, there is the hotness, right? Yeah, so right side mastered is the dryness. Okay. Done? Clear? Any question, Maitri ji? Okay, हाँ बोलिए बोलिए, unmute.
Sir, right is humidity, right? Because dryness is before the ear.
Yes, right. You're right. Right is back. That is humidity. Yeah. So here, wind heat. Yeah, you're right. Wind heat, hotness, humidity. Yeah. We have to make the circle. Yeah, good.
Thank
Video.
you.
Acha, anyone? Okay, Arunji, I will check. Video I uploaded. Maybe some mistake is there. I will re-upload. Don't worry. Okay. Fine. So all of you are able to see the video of yesterday class? No? Have anyone tried to see the video of yesterday class? किसी ने कल का वीडियो देखा? किसी ने नहीं देखा? टाइम ही नहीं मिला. आपने देखा शोभा जी? टाइम नहीं मिला. Okay, no problem. I will check if video is there. Actually, right now I'm telling you select the yang meridian. This question, why we select the yang and yin, we will discuss. Like today we discussed many things, like retention of the urine, excessive energies, incontinence, not able to hold the urine is deficient energy. In this way, slowly we'll discuss everything, even when we are choosing the yang, when we are choosing. Yeah, I will see. Video uploaded, maybe some mistake might be there. I will correct it. Don't worry. It is there. Karishta ji has seen. So if Karishta ji has seen, it should be there.
11 day, 11 day.
Okay, please, those who are able to see the video, please go and see whether you are able to see or not. And so that I will get confirmation that everything is going right. Okay. Thank you so much. Let's close the session. See you tomorrow.